The CDC has made major changes to its vaccine recommendations, more closely aligning with international norms in other developed countries. NTD's Melina Weisskopf is in D.C. reporting live with us this morning. Melina, good morning. Tell us more about the changes the Trump administration is making on the vaccine front.
Hi, good morning, Steph. So the CDC is now narrowing the number of shots recommended to all children from 14 types of vaccines down to 8. So the ones that are dropped here are influenza, rotavirus, hepatitis A, and meningococcal disease. The CDC previously dropped the recommendations for hepatitis B and COVID-19 last year, but shots for the vaccines that are dropped from the broad recommendations will still be available, and all the diseases that were covered by the previous immunization schedule from the CDC will still be covered through the Affordable Care Act and other federal programs like Medicaid and the Vaccines for Children program. So the goal here is not to take back to allow parents not to get those vaccines
up a little there.
And to provide them.
The goal here is?
Can you hear me?
Got you.
Yeah, so the goal isn't necessarily to take vaccines away from families, but it's to try to provide more transparency about the risks and benefits that are associated with these vaccines, allowing for more room for conversation between doctors and parents. The Trump administration decided to take this direction after telling the CDC to look at other countries, like you mentioned, to determine if there's other developed nations that perhaps have a more appropriate schedule for children. So the CDC says it consulted with countries like Denmark, Germany, and Japan. Also, they consulted with the vaccine scientists at the CDC and FDA in order to make these new recommendations. Now, the Health and Human Services Secretary, John Kennedy, said of the change, after an exhaustive review of the evidence, we are aligning the U.S. childhood vaccine schedule with international consensus while strengthening transparency and informed consent. This and rebuilds trust in public health. Now, of course, some health experts are concerned about the broader impacts, like if it will cause confusion broadly or what it could mean for public health. Now, one pediatrician based in California, Dr. Joel Warsh, told the Epoch Times that the pushback is to be expected, but also clarified that reducing universal recommendations doesn't necessarily mean vaccines are being banned or declared unsafe. It just means the CDC is acknowledging that not every vaccine has the same risk-benefit profile for every child, Steph.
Well, thank you so much for this update, Melina. I'm sure we will be touching base as anything else further to this point comes out. Thank you so much.